Okay, everybody, quick test. We're going to do forecourt dominance, that corner in the, right there where there's two walls meeting the ceiling. Point at it. Everybody point at it and line up your finger there. Okay, is your finger on there? You close your left eye. If it did not move, that means you were storing the information with your right eye.
It moved.
That means that you were probably storing it with the left eye. Okay, now put your hand down. Go up again. Close your right eye. Did it move? Okay. You want to be using, so if it moved, that means you were using the other eye to store the information. When you close your left eye, and if you're right-handed and it didn't move, that's good. If you're right-handed and you close your left eye and your finger didn't move, that's good. That means you use your right eye to store the information.
It's only good if you're right side.
Well, I'm sure. If you're right-handed, if you're the other way. Yeah. If you're left, that's going to mix me up. You do the left side because you're left.
No, I think you get the idea.
Yeah.
It's in the learning disability article we're looking to see it.
But that gives you the idea that dominance is an important thing, and you actually really do use only one eye or one ear, or should be using only one eye or one ear to store information. If, by the way, it moved both times when you close your left eye and then when you close your right eye, that means that you're mixed dominant. About 50% of the time you're using the left eye to store information, 50% of the time for the right eye.
Let me tell you what the storage of information is all about. What I tell the kiddos when they're mixed dominant, we've got to do something like Patrick and I are plugging in there to establish the pathways to make them neurologically organized. I said it's like if you store all your books and toys nice and neat on shelves. And Mom says, go get me this book. You can go right into your room, pull that book off the shelf, and hand it to Mom. If you store all your books and toys in a big toy chest, and Mom goes, go get me this book. Well, sometimes you might find it 25% into looking for it. Sometimes you may empty out the toy chest halfway and you find it. Sometimes you have the whole toy chest emptied out completely and you can't even find it.
A good analogy would be what my desk looks like right now.
That is, if you are mixed dominant, you are just storing it, everything you learn, in that toy chest. Sometimes you find it, sometimes you don't. If you're neurologically organized, you're storing everything on shelves, and you can access the information, which is why when we have children come in, and they're behind in, say, mathematics, and we don't do math. We say, we're doing this in this plan of action. We're not doing academics for 4 months. We can't lower the intensity of what we're doing by doing too many things, so we cut out academics. And then 4 months later, the child's reading levels go up, their math levels go up, everything goes up. We've seen math go up and reading go up 2, 3, even 4 grade levels sometimes in 4 months.
The child that I was telling you about earlier that had ADHD or ADD kinds of things, and his focus and impulsiveness improved over 4 months, we did absolutely no academic work with him because it was pretty grade appropriate, and I knew the processing was the issue. We worked about an hour program once a day for about 5 days a week. Worked on the dominant 7 days a week. When I retested him, his reading had gone up 4 grade levels, his word record a couple of grade levels, his math up a grade and a half. We had done nothing on any of that.
The reason is all your years of teaching and thinking it wasn't getting in, it actually got in. It was just in that toy chest. And now they're able to find it and access it. And that's why the academics went up, because we got them neurologically organized, or we're on route to getting them organized where it can come from. For the ear, what ear are they using to hold the telephone to? What ear, when you're talking to them and you're talking very low and you're getting lower, what ear elicits the head shift? They want to hear, the brain wants to hear, it'll turn. What ear do they hold a watch up to see if it's ticking, or hold the watch midline and ask them, does this watch tick? Get close, get close, get close, does it tick? What ear are they using? Again, what foot are they using is what foot are they hopping on, what foot are they kicking with, what foot do they lead up with, what foot goes in the pants first. All of those should be either left or right, depending on where their dominance is. If it's not there, then we have to do what we call occluding. We need to cover up an eye or plug up an ear in order to give the opportunity to build the pathways and retrain the brain to appropriately use that pathway for the input of information. young children, maybe you'll include the I for maybe 4 hours a day. Older children, young children 2 hours a day. Older children, maybe 4 hours a day, if you're doing this on your own. Auditorily, if you're going to occlude the ear of a young child, maybe 4 hours a day. A medium child, maybe 8 hours a day. An older kiddo, all day long. From the time they get up to the time they go to bed. We want that pathway developed. Now, having said all this, the last thing we're going to talk about, handedness.
This is huge.
Is very, very critical not to influence your child's handedness. The genetic coding surfaces somewhere between the ages of 5 years old and 8 years old. Most of our children have long determined that hand that is their dominant hand long before the genetic coding ever surfaces. So don't require a lot of handedness activities. Crawling and creeping is what organizes the lower levels of the brain in order for the genetic coding to surface. How many children did not crawl and creep, thus the genetic coding did not surface because the organization wasn't there for it to surface? I am seeing a multitude of children who are the wrong hand, and it's causing a myriad of problems. Every child I've ever worked with or adult I've worked with, every single one of them that had a bipolar or schizophrenic label were the wrong hand. It's huge. Absolutely huge. I'm going to write a book someday. No colors, crayons, or scissors before the age of 5. Handedness is really important.
And if you suspect that your child has chosen the wrong hand, do not try to change them on your own. Because it can cause, if you go the wrong way, it can cause a lot of emotionality. I think, I don't want to advocate, I guess I am kind of selling us, but you're better to come to someone like one of us who can guide you through the process, make sure all the lower levels are laid down, and then help you to assess whether we're actually going the correct way or not.